welcome to this first GIJN webinar on COVID-19. My name is Anne Koch. I'm the Program Director at the Global Investigative Journalism Network, and I'll be your moderator for the webinar today. And as you've seen, this is the first webinar in a series that we're planning on investigating the pandemic. And this one is called Digging into COVID-19 Stories. And it's going to focus on how to investigate the many issues associated with the virus, both now and also in the future. So that's how we're going to spend the next hour and 15 minutes or so. Just briefly, for those of you who don't know or are not familiar with GIJN, or the Global Investigative Journalism Network, we're the largest global network of nonprofit investigative journalism organizations, and we have 182 member organizations in 77 countries. We work, of course, with journalists everywhere, not only our membership in nonprofits and commercial organizations, and of course, freelancers. We were established to connect and to support them. So do check out our website, which is GIJN.org, and our many resources there, and we have newsletters as well, which you can sign up for. So today, I'm delighted we have three absolutely terrific and very experienced journalists with us for the next hour and a quarter, as I said, who are going to share their tips on covering the virus and also answering questions. And I'm now going to introduce them in the order they're going to speak. First, Gloria Riva, who covers health and business for Italy's weekly L'Espresso newspaper and has been reporting at the epicenter of one of the worst hit countries in the world. Joey Chi is GIJN's Chinese editor, and he has been following and chronicling the resurgence of investigative stories coming out of China and what journalists everywhere can learn from that experience. And Drew Sullivan, editor-in-chief of the Organized Crime and Corruption Reporting Project, is focused on how criminal groups and corrupt officials may benefit from this pandemic. So all three speakers are going to share their investigative angles to the crisis. We're really focusing on investigation here that have emerged and also need following up, but also that will emerge. And they're going to give practical tips and advice, but put their respective contributions in context. We want to hear from everyone who has joined this call as well. And as I said, there may be hundreds of people out there. We'd like to hear from all of you, but we can only handle so many questions. And I just wanted to talk a little bit about the logistics before I turn over to our panelists. 75 minutes long, approximately. Each of the speakers will speak for about 10 minutes first, and then we'll take questions and comments. And you can send written questions in, please. There's a Q&A box you'll see at the bottom of your screen, and you can type it in there, write it in there. And then my trusted colleague, Eunice Au, is going to actually read them out live before we turn to the panel to help answer your observations and questions and so on, respond to them. My final point is this, that we are recording this webinar, just so you're informed this is being recorded. So without further ado, Gloria, can I turn to you, Gloria Riva from L'Espresso?
Thank you, Anne, and thank you to everybody, and thank you for this invitation. I want to start with good news from Italy, especially from Lombardy, where I live. Now the scientists say that we have reached the peak, and now we are working on a plateau, and we are waiting for a drop. So in 2 or 3 weeks, maybe we will be out of this emergency. My work on coronavirus started at the end of February. The first case in Italy was February the 21st. And for journalists like me that covered the effect of cuts and privatization on public health system, it was absolutely clear that we were not able to afford the tsunami in the hospitals. How can I prove it? I contact a university, an observatory, the name is Cergas Bocconi, and this observatory created a constantly monitoring of the sustainability of the Italian health system. And they give me a lot of data. And a lot of professors helped me to understand why the hospitals in Italy and in Lombardia were not ready to do that. So the first tip I give you is to find an observatory like this. And the first number you have to look for is to calculate how many intensive care units you have in your hospital in your country. The perfect number is 28,000 beds in intensive care units. This is the number of Germany. So Germany is 80 million people. 80 million people, 28,000 beds, okay? In Italy, we had 8,000 beds for 60 million people. So really, really few beds in intensive care units. And this is the start point. We understand we were really not ready. In 1 month, the government created 2,000 more beds, but is really not enough. And this is for this reason, yes. Italian population is really old, and is one of the matter because a lot of people die in Italy. But the other meaning is that we don't have beds, and so a lot of people die in their home. Okay. The second number you have to look for is the number of doctors and nurses for patients. So the perfect number is 5 patients for each nurses and 8 patients for each doctor. We have 15 patients for each nurses, okay? And it's more important for nurses than the doctors, because the doctors give, say what you have to do, and the nurses really take care of these patients that need a lot of assistance, a lot of time. They have to be seen every day, every moment, turn on the bed, okay? So the first tip is to find these numbers. You can find to contact the Cergas Bocconi in Italy, because they have a lot of number, not only from Italy, but also for Europe and for other countries. I spell it CIRGAS. Other data you can find in the World Health Organization. And for European people, you can find something in Eurobarometers. This is the first advice. And then the second step of my work was to contact with these doctors and nurses, because they are in the front line, so they can give you a lot of tips. And the bad news is that all the health system have forbidden the employers to speak with journalists, because they don't want people know what a mess is going on in the hospitals. But the good news is they really want to speak with journalists, because from one point of view, they want to share their trauma, their situation, bad situation. And from the other one, they want to tell you the lack of personal protective equipment, the masks, they don't have the mask. And the huge amount of doctors and nurses that are that contract the virus in these days. And it's really a big problem. And so how can you reach them? One idea, and I follow with this idea, is to contact unions, because if you find some union rep or union steward inside the hospital, they can speak, so they can tell you what is going on inside. The other tip is to try to contact the association of doctors, especially the anesthetist, because the anesthetist is the head of the other doctors. So if you can find them, they can explain you what is going on inside the hospitals. And the other thing that they will explain you is the big disorganization inside the hospital, because nobody is ready to do that, not in Italy, not in French, not in Spain or in US. The third aspect we analyzed as Espresso was the lack of dispositives and the big black market for gloves, for masks, for sanitizing gel. We find this information from police because they made a big investigation in order to cut down this illicit traffic that in Italy is really linked with mafia and Camorra. Then the third really interesting aspect that we are digging on these days is the public orders of the masks, so the supply chain of the mask and or the other dispositives. In this case, we discover the inability of the government to choose the suppliers and to obtain the mask. And they did a lot of mistakes. For example, they trust charlatans. They lost a lot of time, especially at the beginning when the virus arrived. You have to be really fast to give answers. And for example, in Italy, the requirement is about 90 million masks per month, only for the hospitals. And now we have 20 million masks for the hospitals. So the people don't have it inside the hospital, doctors don't have it, and they reuse it every day, sometimes for 1 week, and it's useless, obviously, because if you take this mask for more than 1 hour, 1 day, you will spread the virus to other people. And about the future, we are investigating we want to monitorize what kind of companies take the contract to build the 3 hospitals we have done in this month, and the company that provide the protective dispositive, because we are sure there are some link with mafia or family linked to politician, and maybe there is a really corruptive system under this situation, but we have to wait to do that because we are at the beginning of this situation, and maybe we have to wait, or in May we can understand who really take this contract. So this is the future of our investigation about coronavirus.
Thank you very much. That's great. Really interesting. It's heartening to hear that it's turning a corner. But there's so much work to do, as you say, still to find out what's really happening. Thank you, and we'll come back to you with the questions. Joey Chi, our Chinese editor, is up next. Joey, over to you.
Okay, thank you, Anne, for having me here. I'm very grateful to have this opportunity to communicate with you. I know it's a tough time for us. Countries are closing borders and blaming each other, and nobody knows how the pandemic will develop or when it will end. But it is so precious that we can sit in this virtual room, sharing our experience and feelings together. As you know, China is the first country to have the COVID outbreak. What you are experiencing right now is what we went through a few weeks ago. So I hope my experience could give you some inspirations. So in today's talk, I'll picture how the Chinese media covering the pandemic and possible investigative angles and some useful tips from the frontline journalist. So the first part regard to how the Chinese media covering the pandemic, I think it can be broadly divided into 4 stages. The first stages is before January 20th. There were very little coverage about the pandemic. And I remember that the headline at that time was the US-China trade deal was signed. The first phase of the trade deal was signed. And some media have exposed the unexplained pneumonia in Wuhan, which caused a lot of concern in the beginning. And people were worried about whether the SARS happened in 2003 has returned again. but the local government kept asserting that there was no obvious evidence of human-to-human transmission, or no medical staff infection is found, or it's preventable and controllable. And the Chinese New Year is coming at that time, so many people just released and live a normal life and prepare for the Spring Festival. And suddenly, the turning point began in January 20th. The Chinese government's senior medical advisor, a very famous doctor called Zhong Nanshan, confirmed human-to-human transmission of the virus in that day. And 2 days later, Wuhan, a city of 11 million people, has been locked down. It never happened in history. And at this point, everyone could realize the seriousness of the matter. Then it comes to the second stage. The COVID has become the most concerning thing to the people, and almost every media in China send reporters to Wuhan, and all the news you can read at that time is related to the COVID. In this stage, the government, the Chinese government, loosens their control over the media while closely keeping track of public opinion in order to adjust their propaganda tactics. A window of opportunity emerged, and medias and journalists produced and published many widely shared investigative reporting with the tacit consent of the authorities. I have a rough statistic. The high quality investigative reporting numbers in this period is around 15 days or 10 days, even more than it has had done over the past several years. You should know China is the number 4 country from the bottom, according to the Reporter with Orders, Freedom of Press Index. So, but unfortunately, the good time didn't last very long. After 15 days, the government quickly tightened their control over the media, while demanding media to do more and more positive reporting. But in the meantime, people is not satisfied with the government's control at all, and the landmark event of this stage is daughter Li Wenliang's death. The daughter got punished by the authorities for warning others of a dangerous new virus in December. And he died of this virus in 7th February. And so people felt very, very angry and used different ways to combat the censorship. And since Dr. Li has a very famous quote when he did the interview with the Poetry magazine, he said, "A healthy society should not have just only one voice." So people shout this quote again and again, and even some people demand freedom of speech on Weibo. Of course, all these things only exist for only one night, and the next morning, everything just has been cleared. And the government's strong control and the people's resist is a characteristic of the third stage. And the first stage just was beginning at the mid-March when the COVID situation became stable in China, and but begins to separate widely all over the world. And so at this stage, many medias turned their eye to other countries, just like Italy, right, the US, UK, right? And it seems that the democratic system is not an advantage when combating the virus. So of course, it's a good time to the Chinese government to do their propaganda works. So this is the things what's happened now. Many reporting in Chinese just focus on other countries' situation. So the second part, I would like to talk about some possible investigative angles from the pieces I have read. The first one, I think, review the crucial point could be a very good way to find an angle. We all know that some decisions made at a crucial time would have a huge effect on what happened later. The situation should not be so bad if the Chinese government not chosen to hide not hide it in the early stage, or if other countries' government take it more seriously when the verses are separated widely in China. So when we reviewing this crucial point, we can ask many valuable questions. For example, one of the first confirmed cases was at the beginning of December, but why did the alarm not sound until more than a month later? And who made this decision? Or why there were so few confirmed cases before 20th January, but after that day, the number increased by thousands and thousands every day? So with this question in mind, I think we can start a good investigation. And the third investigative angle I would like to share is investigated disinformation. I think big news always come with fake news. Some of them are produced by the government, and some of them are produced by some, we call it self-media in mainland China. They always do contact for money, to earn money. So I think it is a very good point to start a investigation on who made this disinformation, and what is the purpose of this disinformation, and who can benefit from all this disinformation, and how they could harm the people who believe it. I think that is a second investigative angle. And the third one, I think, is you can try to move your eyes on things out of the spotlight. Journalists often focus on major cities, major hospitals, and small cities and small hospitals always has been ignored. But you may find some important leads in these, ignored things, ignored places. For example, when people infected with the coronavirus, in the early stage, the symptom just like a cough or cold or fever. So they are more likely to visit a nearby health center or regional hospital rather than a big hospital. So if you go to a small hospital, you can find some very, very good leads to stories. So, and the cities like Wuhan, Hong Kong, New York, London are under the spotlight, but there are still many small villages or small towns, small cities near them. And maybe many more terrible things happen there. And if you go to these small cities, you may find some very, very touching and important stories there. So in the third part, the last part, I want to share some tips from the frontline journalists in China. About 1 month ago, I interviewed four journalists in mainland China, and they shared their tips with me. So I also wrote an article on which published on GIJN's website. So I pick up 3 important tips for the international journalist. So the first one is to learn the basic laws and regulations. If you are not a health reporter, make sure to acquaint yourself the basic laws and regulations for infectious diseases, as well as preventions and control procedures. For example, what are the diagnostic criteria for COVID-19? What are the procedures for disease reporting? What are the disease control methods? going through this information will help you understand the system of the infectious disease prevention and treatment. And the second one is scrutinize policies. By examining policies for prevention and control of the disease, you can often find story leads. For example, after a city was placed under a lockdown policy, try to think about what kind of problem the resident might encounter. Will there be any shuttle service provided for the patient who needs to go to the hospital? When making these policies, has the local government taken this into their consideration? Or by scrutinize such policies will be able to uncover unreported stories. And the last tips is provide clear explanations. Infectious disease is a professional field, not only to the reporters, but also to the public. So interpretive reporting is very important at this time, and only then can the public get a better understanding of the entire situation. So that's all of my presentation, and thank you very much.
Thank you very much, Joey. That's marvelous, and really adds to and complements very strongly the tips that Gloria has suggested. It's also been really interesting to hear about China in particular, and there's a lot of questions coming in, which we'll get to in a minute, I hope. So Drew, over to you, please. Drew Sullivan from the Organized Crime and Corruption Reporting Project.
Great, thanks for having me, Ann. It's always great to be a GIJN event, and you guys do such a wonderful job of working with investigative reporters all over the world and sharing that information. So this is the story of the decade. I mean, this is maybe one of the most important stories that some of us will cover in our life. And for investigative reporters, it's difficult because this in many ways seemed like a daily story at first, and then it really, as it started to develop, you know, it was really clear that this is actually a huge investigative story. But I think there are two phases that we're going through. The first is what I call kind of the wartime phase. This is covering COVID is a lot like being a war reporter in many ways. It really is, you know, you've got an enemy out there, society is knocked down, you've got very few sources you can go to. It's complex. Nobody really knows what's happening around. We're kind of in this period of chaos in a lot of countries, not sure what's happening. And that's exacerbated by the fact that many of us are at home. So it almost feels a lot like war reporting. And it's also dangerous. You can get killed if you're not careful. And in war reporting, it's very difficult to report. It's very difficult to get on the front lines, and the front lines are spread out all over the place. It's taken us time to really figure out what's going on. And I really credit my colleagues who are reporting this on a daily basis. The work that they've done has really been exceptional around the world. I mean, there's examples of amazing work. There's some examples of not so amazing work. But for the most part, you know, I think journalists have done a pretty good job of tackling this. You know, in that kind of a wartime daily zone, I think that there are some really important issues to keep in mind. I mean, first off is understanding the disease and how it works. You know, as investigative reporters, we always say, figure out the system. We have to know how the system works. And it was clear in the early reporting that reporters really didn't know how disease worked. They didn't know how viruses worked. And therefore they were manipulated, and they were, you know, they based a lot of information on sources that were not so good. So it really is like any good investigative story, you have to develop your sources. You have to rely on good people, and you have to figure out, you know, who can give you the information on a regular basis. The other thing, as Joey pointed out, you have a lot of propaganda going on. You have state level propaganda from Russia, from China, from the United States, and then you have kind of political interests. You know, even organized crime groups have their propaganda going out, giving masks out to a hospital, you know, on behalf of an organized crime group and these types of things. But, you have a lot of people who are seeking to spin this, and especially in autocratic countries, because you have a situation where, you know, many countries are handling this quite badly. And we haven't seen how badly some of these countries have handled it yet because the disease hasn't really run its course there. But we will start to see that over the next, you know, 2 months, a lot of people dying in a lot of parts of the world. And those governments are not going to be able to tolerate that version of history being out there. And so there will be a lot of internal propaganda to spin the story and to turn a government that actually killed a lot of its people into a government who supposedly saved all these people and did such a wonderful job. And I think a lot of American reporters are seeing, American people are seeing that going on right now. Another thing during this kind of early phase, I think it's difficult to do, is a lot of reporters want to rely on data right away. And I think data is very tricky, especially when, you know, a lot of the conclusions really require an epidemiological study and not a journalism data analysis, you know, taking the numbers. This is far more complex of an issue, and we have to respect that health issues are things that you need to respect the science on and don't think that you know things. But it's also, there's opportunities here, because I think, you know, people are willing to talk. People are dying out there. And when people are dying, people get angry. And when people get angry, they talk. And when they're not in the office, when they're at home, sitting there all alone, that's a great time to talk to people. And I think as journalists, we need to be much more source-driven during this time, to talk to people who have knowledge and understanding of what's going on, and getting them to talk to you over the phone, which is important. Documents are just being generated now, and we won't always get access to those documents until later. So it's a little bit more difficult to do truly document-based stories. What I also think is important is to stay away from kind of traps, which are, you know, stories about how the disease spread, you know, or who caused a disease in a particular area. That also leads to racist reporting, you know, blaming people for getting sick, which you can't really do. I think we need to, that's not the most important issue. The most important issue is how governments are handling this. They have the information now. You know, this is an issue now that is fairly well understood, even though the disease is not completely fully understood, but how this is working in the world is understood. And so there's a lot of information that we can be looking at. Now, the next stage is the investigative side. And I think we should be prepared for this taking maybe a couple years to truly get the full story out. It's going to take a tremendous amount of time to really understand some of these issues. And I'll talk a little bit about the areas where I think are important. First of all, how government has dealt with this. A lot of times during these types of crises, people don't spend a lot of time looking how all the different levers of government really worked in fighting this. But there will be a time to go through that and look very carefully at what people did, how they did it, what information came out, what information was hidden. And that's an important story, because that will help us be prepared for the next epidemic, which will certainly come at some point. And so, you know, what was supposed to happen, what did happen. And there's a lot of information that's spilling out, and it's hidden in thousands of news stories, and it's hidden on social media. And that information has to be kind of gathered up to piece together basically what government did, what people said, and what actually happened. So I think that's a really important story that we all need to look at. I think this issue of surveillance of the public and the laws that have been put in place are a really important issue. You know, we're seeing in Eastern Europe where governments are using this as an excuse to basically gut freedom of information laws, to hide, you know, contracts and tenders that are going out, to put laws on the books to prevent freedom of speech and people discussing this issue in what they consider a harmful way. We have these fake news laws that are being propagated, especially in places like Hungary and Serbia and Bulgaria and places like that, that are really designed to take advantage of the virus. And so you might see that start showing up in election laws and other places. So how government is changing the laws right now is a very important investigative story and can be done right now. And then, of course, the big issue is follow the money. I mean, that's what we do as investigative reporters. We follow the money. And there is a tremendous amount of money being spent now by government. You know, the United States is just done a $2 trillion bailout, although it's not completely clear who they're bailing out, and it's not completely clear, who needs this money and why they need this money. And people who have done, businesses and companies who have done stupid things to date and now are getting bailed out for being bad business people. So I think the things that you want to really look at are tenders. The government is giving out tenders and contracts often on these abbreviated systems, where they're just kind of pushing them out without going through the tender process. Who's getting those contracts? What are these contracts for? How they're stipulated, what was actually delivered, and I think you'll see the government is buying large amounts of medical supplies, but they're not getting large amounts of medical supplies, often because they're paying exorbitant rates, possibly because they were cheated, but also possibly because, as is the case in many of our countries, when large amounts of money go out, 20, 30, 40, 50% of it goes off into the pockets of, people who are involved in the process or friends or relatives. So if companies have just, suddenly appeared providing medical supplies in your country, I would be very suspicious of those things and be looking at when these companies were formed, who's leading them, where are they located, if they're offshores, obviously, that's a big issue. Many countries are getting assistance from abroad, from the EU, from Russia, from China. Where is this assistance going? How is it being documented? You often can't find it out from the country itself, but you may be able to find it out from the donors who gave the money. How did the government report back how this money was supposed to be spent? Did you require that they, report back on this and give you tenders or contracts or other things like that? Some countries like Sweden and the United States will require that. Others may not. A lot of this money is being rebudgeted. And so you should look at budgets and look at how they're changing over the past year, which departments have gotten additional money. What you might find is that a lot of this money is going into propaganda or law enforcement or other things, and not necessarily into the healthcare sector, which is often underspent on in most countries. We want to look at that. You can also look at import and export data as a separate check on this. Go to ComTrade is a good example, and start looking at changes from year to year in the medical supplies. Those numbers will start coming online fairly soon, and you can start looking at the early days of this, what exactly was happening in terms of products that were moving back and forth between various countries. There's been the word that some of these countries have outbid other countries. We can find out from that type of data which countries have been bad actors on the international market in trying to corner or get a majority of the medical supplies that are out there. And of course, there are gifts that are going on. Azerbaijan has raised $87 million from state agencies, but also from the public to kind of treat this. I don't know why Azerbaijan is doing that. They have a lot of oil money. Should be quite wealthy, but in fact, they're making the public contribute, and they're not particularly clear. There's no system to necessarily see how those monies have been spent. So sometimes the way to look at it is from the other way around. You may not get access to the information on how it was spent, but you can go out in the field and see how the money actually, where it ended up. Did it end up in a hospital? So look on the other side of the equation and see if you can find out how many new ambulances were bought or how many new ventilators were bought with that money. It's difficult and it may not be clear at first, but then we rely in time on tipsters and others within the system who are angry that people have died. And that's the argument we make to them is, hey, look, people died. Let's find out who caused this death and get people to start giving information to us. So
good. Thank you very much, Drew. While everyone turns their microphones back on, the panelists that is, so we can take some questions. And so Eunice can get ready to put some questions for to the panelists. Perhaps Eunice in groups of 3. I just wanted to pick up directly from what Drew has said, because before the webinar started, we had a question that picks up directly from, well, in fact, 2 that pick up directly from what you just said about following the money. One from Kaba in Sierra Leone. And Kaba was asking how we dig into money basically given out and received by governments and others. And either in cash, donations and gifts. And also the same question was asked by somebody from Bangladesh, really on corruption. So I think you've given there a good sort of checklist on follow the money. Is there anything you specifically wanted to add when people find it very difficult to find out how their governments are dealing with money? Because in both these cases, they've expressly said it's very difficult to find out.
Yeah, it is difficult. And I mean, but to give an example, I was working with a journalist who was trying to figure out what the budget of the Croatian army was. And it was very difficult. The government refused to give that. They called it a state secret. So he went through this process of figuring out, well, how many soldiers are there, how many army bases are there, and how many airplanes they had, how much money does it cost to maintain an airplane. And he literally recreated the budget himself. And when he went in to talk to government officials, he said, well, you're spending this amount of money. And they said, how did you know that? That's a state secret. And he was about 2% off, he found out, just by recreating it on the other side. So sometimes what you can do is, I mean, there's a finite number of hospitals in the country. You can find out how much extra staff was on, how much extra materials came in, how many patients did they treat, and you can actually recreate how some of this money was spent. And so how much they received, and approximately how much was actually spent on this. And so you can see how big of a difference is. Now you got to talk to a lot of experts, and you got to make sure your numbers are good. If you do a really bad analysis, it's going to be hard. But if you talk to enough hospital experts who are willing to look over your numbers, they might be able to help you do that. So, that's one way of doing it, recreating it on the other side. The other thing is, there will be almost every family on earth will be affected in some way. And somebody who handled those numbers had a family member who died. And that's the kind of leverage you use to say, look, your family member died because of this. Don't you think it's important to tell people exactly how this money was spent, and how did it, where did it go? And then, of course, again, looking back at the businesses, what businesses formed, around this time. I mean, you can look at it and from, the days that these contracts get issued, companies get formed, and you can trace those and see if they still exist. And what addresses were they operating, who owns those properties, those kind of basic investigative reporting questions.
Thank you. Eunice, some questions.
Hi, yes. The questions, they can be categorized in a few different things. People were asking about the public procurement of items. How do you track this? How do you track the donations money that's going into coronavirus research and helping the people right now? Questions on data, and also questions on China. Of course, that's a big one. So maybe we can start, with
Go
one
ahead.
category. Public procurement of items. Shipos Zoltan asked about CPV codes because they are tracking public procurement databases for medical equipment, but they find it difficult to find these CPV codes because they not only buy medical stuff, but also regular work safety equipment. So do you have a list of CPV codes?
Do we know what CPV stands for? I don't know. Does anyone? Okay. Gloria, do you know? Keep going. Sorry.
I think that it's the number that agree that you can use it in one country or not. It's like the so you that you can use in some situation or not. You can use it, for example, for hospitals. You can use the mask for hospitals, or you can use the mask for works in buildings, for example. We had a case of this in Italy. I cover it because they take the mask for buildings to doctors and nurses, so they can filter the air from outside to inside and not be in the opposite side. And the nurses discover it because they look at these masks and say, it's not a usual mask, it's like the mask of my employee at home that is fixing the house. And so they understand it. I think that the number is that one. And
Thank
it's
you.
true. It's really difficult to find that, also because now, because they can't find a real mask, the FFP3, the FFP2, they agree to use other masks. So
yeah, I understand. I think it's we're getting a few really helpful messages coming down on this common procurement. Yeah, go ahead. Sorry.
I think what these are is so when you're doing mass statistical data, you need to explain what an item is and you give it a code number. And it is problematic because these codes can be used both, industrially and medically. But I think what you can look at is you can look at the differential pre-virus and then during the virus to see that differential is likely to be the ones that are related to the virus procurement. So that's the only way you can do is to look at what kind of the baseline was for usage of this, and then you can find anything that grows from that is probably virus related.
Sorry, Eunice, I broke my own rule. I said three or four areas, and then we'll take responses. And right away we jumped in on one. But please continue on procurement questions.
In Norway, Peter Sva is currently also investigating PPE procurements by government agencies, how much overpriced they are willing to pay, and where a shipment of defective masks came from. So they're asking anyone else working on this and have tips on possible data sources. And Alex Cooper, he's asking for all three of the speakers, how could the gaps of provision allow corruption during this time? He's thinking of the lack of some medical equipment, medicine, food, how criminal groups or corrupt figures could use that gap to disproportionately influence communities.
Thank you. On the first question, I think it would be good if anyone can respond to our colleague in Norway on the Q&A board. If you want to leave your email address or a contact or whatever, and then he will then see it. He or she. Sorry, I didn't catch Peter. I think it was. Norway. So yeah, that would be.
I was going to say, we have been tracking some of these, Peter. So if you wanted to contact me, we've been collecting mask prices from all over the place. We've also been tracking, some of the fake. A lot of countries have been hurt by kind of fly-by-night organizations that have started shipping stuff. It's also testing. There's a bunch of tests out there that are worthless, and they're being sold to countries. And so sometimes this is a corruption where they know that it's worthless, but they're buying something worthless to look like they're doing something, but they're actually moving that money off to themselves. Other times they're just getting cheated. So there's a lot of cheating and corrupt stuff that's going on across the board. And so where reporters a number of reporters are tracking these specific instances, specific companies, and specific statistics, and we can
Gloria, sorry, Drew. Gloria, you were talking about the mafia already getting into the provision of basic goods. Do you want to say a little bit more about that now, in answer to the question on procurement of basic provisions?
We know that mafia try to enter inside the supply chain. So because the government in this moment can't find all the dispositives and all the masks and the gloves, they really open the question to all the companies, and they really don't care who is behind the company. And so for the mafia and for Camorra and for bad companies, it's really easy to try to enter in this supply chain. And we are only at the beginning, and the police can understand that something is going on in this way. But we need some more time to really understand it's how many companies are linked to mafia and how are really good company. It's really difficult because really the government can't find the masks and gloves, and so they trust everybody. They trust charlatans, they trust mafia, and everybody.
Sure, thank you for that. I mean, some of the resources that are being mentioned, and I see being put up on the Q&A, we'll be publishing an account of this webinar and some of the contributions being made, and we can include some of these helpful suggestions. Eunice, perhaps we could go to the questions on China now.
Yes.
Thank you.
Questions on China transparency. I just picked a few because there's so many that's coming in. Desisla Mikovas asks, how do you verify the numbers of the infected and dead people? Mural Krishnan, has the Chinese government suppressed figures? Do we actually know the real story? And a bunch of people asked that there were some journalists that disappeared, and does Joey know anything about that? And Desisla Mikova asked again that China has been sending aid all over the world and prompting praise, but is it also a way to, exert their soft power onto the world?
Okay.
Joey,
wow,
that's quite a raft.
Yeah.
Thanks.
Quite rough. Yeah. I'd like to answer the question: how many journalists have been arrested in China? According to my knowledge, at least 3 citizen journalists have been put to so-called self-quarantine at this time, or we can call it home arrest. I believe they are safe and they will be released after all the things go away. But now at least 3. A lawyer called Chen Qiushi, you may know him. He has a lot of followers on YouTube. He went to Wuhan for at the beginning, and he has been arrested after around 10 days. And another former CCTV journalist, Li Yongbing, I forgot the exact name, and another citizen journalist called Fang Bing. These 3, according to my knowledge, I know, but I don't think any the journalist from the mainstream media has been arrested in mainland China at this moment. According to my knowledge, only at least 3 citizen journalists has been took away. So the figures, yes, it's a very hard question to answer, because I also have this question. Of course, the numbers provided by the Chinese government is definitely questionable. I don't believe it personally, but it is very hard to find ways to verify it. I saw some of you just provide some methods to verify the mobile numbers or the funeral urns. I don't know. I'm not sure it is a good way to verify the numbers. So, but in this stage, I think in China, many things is just under a black box. You don't know, and you don't get you cannot get other numbers to verify these numbers. So it becomes very, very hard to verify the numbers. So I don't think to use the despaired mobile phone numbers to assume the people just dead, because the mobile phone numbers disappears could be a lot of other reasons. So it is very hard to verify. But I don't think many people died directly from the COVID. Because according to my knowledge, I lived in Hong Kong, and we have over 700 confirmed cases and only 4 people dead. So the COVID death rate is not that high. but I believe in Wuhan, in Hubei province, it caused a lot of indirect deaths, especially in some small cities or small towns. And of course, this number cannot be counted to the official figures. So, but unfortunately, I don't know if there are any way I can verify the number, and no other Chinese journalists could do that, because it could be very, very dangerous. And to talk about the soft power, of course, the Chinese government is, to help other countries and to send experts to other countries to help other countries to show the soft power. Yeah, and and within in China, and they also use them to do some propaganda works, as I described. So it's a sad thing, but it seems that and I see some people ask what's the different ways that Chinese journalists report this issue with European journalists. So I think the biggest difference is, when Chinese journalists reporting this issue, they always have a line or we call it self-censorship there. You cannot cross a line, or your article could not be published, or it will be deleted very, very fast. But this time I find some things that's very encourage me, because some media just publish some stories. I know that's crossed the line and it has been deleted very fast, but they publish it. And once the article has been published, maybe it cannot be totally deleted from the internet. And I can send you a link and an article called the Visual Sender. Sorry, I just find the chant function. Okay, you can check this link. This is an article that published in early March. Is about the first whistleblower who sent the whistleblower the whistle. It's a very good story, and it has been deleted very fast. After 2 hours, it has been published. Then people use different ways. Even use emoji to tell the stories. Use different way. You can use, if you don't know Chinese, you can use Google Translate to translate all these versions. It's hundreds of versions. Some people use traditional Chinese to rewrite it. Some people just use Cantonese to rewrite it. It is very funny. And it shows people in China are very, very angry about the strict censorship of the government, and try to use everything they could image to send out the truth, send out the really good report. At the night of Li Wenliang's death, the same things happened too. So yeah, this is the situation. The people in China tried very hard to tell the world what's real happening in China, but the government's pressure is very, very strong at this moment. So, and a lot of disinformation on Weibo or WeChat to show how China deal with these things very good, or how other countries just fail to prevent the disease. Yeah, this is a combined the people versus the government, very strong. Yes, and the same things happened last year in Hong Kong's pro-democratic protest, but this time I think the situation is more encouraging me. People in China still want to get the true information.
Thank you, Joey. I mean, just for everybody listening or participating in this, Joey, of course, will be continuing to look at this as the weeks and months go on. There may be more questions for him, but Eunice, do you want to help us with another lot of questions, please?
Yes, I'm moving on to another category, which is following the donation money. A few people brought that up. Tessa Fox said that her country is specifically taking donations from private companies, from individuals, and saying that they're going to distribute it to the public. So how do we find out if that's really true? Abiodun Jamiu in Nigeria also said there's tons of donations going on in Nigeria. How does one follow the money if there's no record of the actual amount distributed to the people? Yeah.
Thank you for those two. I don't know, Drew or Gloria, do you want to take the donations one first before we go to the question from Nigeria? Somebody else also is saying the same situation in Liberia, I see on the message on the Q&A board. Gloria?
I mean, I think
Oh, sorry, Drew, go ahead then.
I mean, I think it's difficult. It's very difficult because this is, you know, it's private money. If the government doesn't want to show the bank account where this money is flowing into and how the money is flowing out, it's very difficult to do this. The only thing I can say is, again, to look at who gave the money, who's publicly announced that they've given the money. People give money, large amounts of money, they almost always announce it somewhere in social media or something like that. So you might be able to just use social media to figure out a number of big donors. And then you can ask those big donors, have you gotten reports back how your money was spent? Is there any, you know, report that you asked this government to give you? You know, can you tell us what you know? You know, and then, you know, otherwise it's extremely difficult unless you can develop a source in the government who can you know, feed you the information on, you know, where exactly, you know, get a bank account listing, which we often do. I mean, we can often get that. It's, you know, it's a matter of source development. So, but it's a difficult thing.
Yeah, very, especially so early on, I would have thought, when
Exactly.
there's no real reliable data, as the point made by a couple of people.
And I think the point is that you will, some of this information will be easier to get later. That's why I said it's going to take a couple of years, because people will be very sensitive to it now, but in a year from now, they won't be so sensitive to it. And that may be when you can get the data.
Gloria, did you want to add to
yes.
that?
Another tip could be to reach and try to contact the hospitals and the public health structure and ask them if they receive the money. So to try to double check if they give the money, if they effectively have the money, and so you can go deeply in the other side. Maybe it's really hard now to understand if everything is clear, if the money go in the right direction, and so on. In Italy and in Europe, we have the antitrust. So I think that in 1 year we can wait some information from them. That it's.
Would there be a way? Would there be a way maybe to set up a system to start to observe now, so that although the information might not be able to be published for a while, you would start to collect evidence in a number of areas, because there's clear areas where spending is taking place, multiple millions, and maybe to track some of it, start even if you can't publish for some time. Are you doing some kind of projects like that at Espresso? Are you planning to track them in collaboration even with other journalists?
We are not thinking about that. There is some projects with Espresso and some US association, but I can't deliver you now.
Okay, I understand. Drew?
Another way is to also just ask the public. I mean, if they're allegedly giving out money to the public to help deal with this, then you can crowdsource from the public and just say, anybody who's received anything from the Nigerian government, can you email us here and let us know about it? How much should you get? And if you're not getting anybody telling you about it, then that's, you know, that's some evidence that, you know, it's just not happening. You know, there's the old saying that, you know, if something is really happening, you're going to know 1 or 2 people who it's happened to, you know, and if you don't know 1 or 2 people that it's happened to and you ask around and nobody's heard about this, then it just may not be happening. And that's the basis of starting a story, trying to find a single person. Do a story about trying to find people who got the money and you can't find any.
Yeah, I think it's just a little preview. We're hoping to do a webinar on that specific topic in the future on how to use crowdsourcing or user-generated content, talk to the public basically, and ask them to help to do investigations. So, watch this space. Hopefully we'll be able to actually help people to figure out methodologies for that and so on. Eunice, more questions, please.
Yes, now I'm focusing more on the data questions. Sonia Sarkar from India is asking, how do you do stories in countries where the government does not release any data or even take any questions? Vinod Kumar Menon, he also asked Drew specifically on recreating figures. How do you safeguard against defamation laws? Because in India, without documents, you can be taken to court for both criminal and civil defamation, as the government can always turn around to say that, hey, these figures are not correct or they are concocted. And also Ahmad El Sheikh from Egypt said that the Egyptian government has always been lying about the real numbers, and we are also prohibited from shooting anything related to the coronavirus. So what kind of tools or strategies can they get around this?
Yes, Joey may have something to say. Drew, do you want about this as well? Drew, do you want to start? So do you got the questions on defamation laws and on lack of data, lack of reporting in the case of Egypt, banned reporting?
I mean, one thing on data is, you're going to have to find proxies for data. So for instance, one of the big problems is the government's not always being honest about how many people are dying, but you can use proxies for death. So one thing you can do is you can look at death certificates. Death certificates are often a public record. So you can go in and ask for every single death certificate, which should give a cause of death. They may not be expecting you to do that. So that may be one way. You can also talk to the casket industry and say, have you had an uptick? How many additional caskets have you imported or produced, in the last 3 months, to figure out, approximately how many people have died. And then of course, developing sourcing, this is a time when you need to find sources in hospitals. Even though they may not be able to talk to you publicly, they can privately tell you, our morgue is full, we've got at least 20 bodies down there. And if you can figure out, there's only 2 or 3 hospitals in many countries that are handling these cases right now, it's a fairly finite, number of places that you have to go to ask. And in many of our countries, everybody knows somebody who works in that hospital. So you have to start developing, that sources, those types of sources if you can't find proxies. As far as, concocting numbers and dealing with the laws on these things. I mean, it's, if you're not allowed to publish a story, you're not allowed to publish a story, but you can say, you can coach something as a thought experiment, or not saying it's actually happening, but saying since the government wouldn't give us this information, we went through a thought experiment of trying to figure out exactly, what's going on in our medical industry. And we're not saying these numbers are accurate, but this is the evidence that is out there in the public record, and this is how you might use this data to establish exactly how much money is going in there. Now, you can't do anything if the government sues you, or if you're not saying that these numbers are accurate, you're just saying this is an approximation, that we're doing to try to get information that the government won't give us. If the government comes and complains to you, then say, well, give us the numbers then, you need to give us the numbers, otherwise we're going to speculate, but we're giving, the methodology that we're doing, and we've had experts involved in this, and this is what they're giving us. But, at a certain point, if, the government's not going to want you doing these things, and you may have to do the reporting for use by somebody outside. So what we do is, if we can't report something in one country, a partner organization across the border reports it, and then they publish it, and then it always gets back into the country. And then you can publish it saying, newspaper over there has said this about us. That's one way of doing this, is use that kind of cross-border relationship to try to do that. But, there's, you're going to get, you're going to get shut down by somebody at some point when you get too close to the truth, and there's no advice we can give you that's going to solve that. Unfortunately, that's the burden we face in a lot of countries.
Yes, well said. Joey, did you want to add to that? I was just thinking perhaps in terms of that, negotiation that a journalist has to do about their own safety and so on, the role of social media there. as you've experienced, you talked quite a lot about that a moment ago, but in the context of people who find reporting very difficult. Some advice.
Okay. I just want to answer a question just proposed earlier about
Sure.
how to do investigations if you cannot gather real numbers, real figures. I think yes, this is a situation which happened in China now, and it's very hard for journalists to gather real number because we can only believe, and all the media could only quote the official number at this moment. But my advice is if you tried very hard at everything you can do, and you find that it's really hard to get the numbers, and maybe it's a time for you to move your eyes to some other important issues. For example, I like a very good investigation conducted by the China News Daily. The journalists just doing a very investigation on how the diagnostic criteria changed and affect on the numbers. And at the beginning, the diagnostic criteria is very loose and very strict, and many people could not be confirmed with COVID. But afterwards, another very loose diagnostic criteria applied, and many people could be diagnosed with that question. But why these diagnostic criteria changed? Who made the decisions? And this is very important. And sometimes, and you can talk to the doctors or some expert, especially doctors in small hospital who just treated the people in the very early stage. So they may tell some stories you don't know, and they may want to share you how the information have been hide from different levels, and you can just write this story and tell the people what's happening now, and maybe that is as same as important to the figures.
So don't give up and try and find something else to report.
Yeah.
The changes in the diagnostic criteria.
Yeah.
Interesting. So I think we just have round for Eunice one or two more questions. Are there any questions we've forgotten that we could bring back in?
That's going to be hard to choose because there's so many questions.
Sorry.
Thank you everyone for sending in. This is not really a question, but I think it's a suggestion from Robert Danin, because this is what they did in New York City. Price gouging, which is an important issue, especially in impoverished communities. So apparently they approached more than a dozen retailers who were cooperative and showed them monthly invoices to help them track this rise in prices. Maybe the speakers can talk about how to investigate price gouging. And also there was a question from Salaheddin Lemaizi. Is there any international database on the tenders of health and medicine? And Rawan Damin, we've never lived in a world where reporters cannot travel to cover a story. So would this new world make cross-border investigations more important?
Okay, sure. Who would like to go first? Gloria, do you have any thoughts on price gouging? You must be seeing that. I think most countries are seeing it. No, you haven't been looking at that. Anybody else want to take the? Well, I think it was a good suggestion. We don't have to necessarily answer the question. It's a good thing to investigate how prices are going up and how to track that. And if the person could please send us further information, we can share that with everybody who's interested. Drew, you were going to say something?
It's really easy because prices are advertised. I mean, you can go out and it's just a matter of collecting the prices, that are available and what agencies are paying for stuff if that's a public record. So you can look at it, and price gouging is legitimate in some senses because there's added cost to these companies as they add new lines and things like that. So you'd expect prices to go up somewhat. I mean, it's an important story. I think it's in the extreme cases where it's most important. But if prices went up 50%, I mean, you kind of got to expect that. And I think sometimes too much is made of it, but other times, it's clear that governments are way, way, way overpaying for stuff. And you got to figure out whether it's corruption or whether it's somebody just trying to take advantage of the situation.
Okay, thanks. Just to end, the question on traveling and not being able to move around, maybe one last observation from each of the speakers to that point. You're on now, Drew, so why don't you start, and then we'll go to Gloria and Joey. Just on the fact everyone's sitting behind their computer in their house, it changes the way people have to report, journalists can report.
It's critical, and one of our successes has been that we have bodies on the ground at OCCRP in the countries we work in. So, having somebody on the ground with local contacts is critical now. So if you're not part of a network, you should find networks and other organizations that you can work with so that you can get that really important on the ground thing. It's not just having, and a virus like this and a story like this, it's not just having somebody in Romania, it's having somebody in Craiova in Romania or Iași, so that you can talk to people at the hospital there. So, this is really the time when you want to be involved in GIJN and other kind of network places where you get those kind of contacts to people so that you can do it. And this is an opportunity here, but it's also an opportunity, in many of the places in GIJN and ICIJ and OCCRP to build those relationships, because it may be impossible to travel to another country, but somebody can travel within their country still sometimes.
Thank you. And Gloria? You're staying in your flat now, aren't you, all the time, and on the phone and on your computer?
Yeah, in fact, when you told about how you can understand if the numbers are right or wrong, one idea could be to go to obituaries. So to understand if the obituaries are full of dead people or not, but we can't move. So the only way we can do is to call the obituaries and ask them if they have a lot of people or not, but they can tell you everything. The problem is this one. So the only thing we can is to call people we trust. So medicians and nurses and the unions and people that we already have contact with them. So we can trust them, or we trust because we can see them in face and go in the hospitals and see the hospitals, see the situation inside them. It's really hard to report this thing now, and I think that when we can go out, we can't see that because all the hospital will be empty, maybe because the pandemic will be gone, I hope.
Yeah, thank you. And Joey, last thought from you?
Okay, I think the one thing you can do is to just search for in your social media. I think social media sometimes could help you a lot when you stay at home. According to my knowledge, I know many story leads just found in social media. In China, many people post help messages on Weibo. And I know some journalists just search these messages and send a direct message to him or her, and have a talk with him or her, and then they know their story and write it out. And another thing is just I agree with Drew. To just you can do some cooperation with different journalists or media. I know even the situation is very serious. Some journalists are still on the front line, and they keep on posting things out on their social media, on their media. So if you can got the contact of this person, of course you can ask some questions you want to ask, and I believe he or she is very generous to share the information with you. Yeah.
Thank you. We're slightly over time. It's been really, really interesting. I'm sorry. I apologize to everyone whose question wasn't answered. We have a record of them, and we'll think about all the questions you're asking, certainly in our future events and the resources that we publish on our website. Before we end, I want to thank both my colleagues, Eunice and Martha, who have helped a lot to make this webinar happen. And I'd also like to give a huge thanks on behalf of all of us to our wonderful panelists, to Gloria, to Drew, and to Joey. And to the audience, thank you very much for joining us. We hope to see you again. We're going to be doing one of these a week at least for the next period. And next week we have one on resilience and reporting, on staying healthy and sane, which is also extremely difficult for many people. And it will take place next Wednesday, not Thursday, but next Wednesday, the same time. So I wish you all very well to stay happy and healthy. And thank you again very much for joining GIJN today. And take care. Thanks a lot.
Thank you. Bye.
Bye-bye.